Welcome to the muscular system. Our muscular system is made up of muscles, which are organs. Their primary function is to move our body. We're only going to go over about 15 different types here, but there are more than 600 muscles in your body, make up about 35 to 40% of your body's muscle mass. That number obviously will vary based on your gender, based on your age, and based on your athletic ability. What do muscles do? They are going to contract and they are also going to extend. Remember from our anatomical terms lecture, contraction means that it decreases the angle or they become shorter. Extension means that they become longer or they increase the angle. So, what is the result of these muscles? They help us move. They generate energy and we can do some type of work, whether that's you doing something athletically or you actually doing some physical work, moving boxes, carrying things, and all that kind of stuff. There are two groups of muscles found within your body. The first one is voluntary, and just like the name implies, voluntary means that you can control them. So anytime you want to get up, move around, chew food, all of that stuff, you are making your muscles move. The other group of muscles are involuntary muscles, and you cannot control these types of muscles. They are going to function given signals and do their jobs without you even knowing it. So, an example would be the muscle around your heart. It contracts from about 6 to 10 weeks of after conception all the way until you die. Other muscles that are involuntary would be if you were to eat some food and you were to swallow it, that food travels down your digestive tract. And most of the muscles that line your digestive tract are involuntary muscles. So you cannot control those muscles. Of those types of muscles, we can break them down on a tissue level. Now, this is just a brief overview. You don't have to memorize every single bit because if you take an anatomy and physiology class, you will definitely get more details on it. So the first type is skeletal muscle. What the name is saying is that skeletal muscles are going to help move your skeleton. So they are the most numerous found in the body. You can see they have these stripes or these striations on it. And skeletal muscle is going to attach to our bones through tendons. The tendons are those thick types of bands, and you can see them kind of around here. They're going to help pull the bone or pull the muscle and help the muscles contract. Skeletal muscles are all voluntary. You can make them move rather quickly, so think about your reflexes, but they also tire easily. Think about if you're out running or you're doing squat jumps. There's only a certain amount of time before that muscle says, I've run out of energy, I'm done, and you need to stop moving me. The next type of muscle is smooth muscle. Smooth muscle is going to be involuntary, so we have no control over it. I talked about it being lining your digestive tracts, your stomach and your intestines. It also lines the walls of your uterus. So when women go into labor and they have what are called contractions, those contractions are involuntary. A woman can't control getting a baby out. The body just starts triggering it naturally. So the contraction and the relaxation of these involuntary smooth muscles are going to happen slowly, especially if it's something that's lining your digestive tract. You don't want to pass that food through your digestive tract very quickly because it would be cumbersome if we were having food go through us that quickly. But also we need to take vital nutrients out of that food that we eat. So it's called smooth muscle for a reason. You can look at it. There are no stripes or striations, and under a microscope, it looks smooth in texture. The last type of muscle tissue is going to be cardiac muscle. The name cardiac means heart. So this is the only type of muscle that is found in your heart. It is involuntary, like we stated before. There are striations, just like we see in our skeletal muscles, and your heart can beat up to 70 times per minute, which is very, very quick. So what are these muscles going to do? These muscles are going to work in pairs together. So in this little diagram right here, we've got my biceps and my triceps. They're going to work in pairs. So when one muscle contracts, the other muscle relaxes. Muscles always pull, they never push. So they're going to pull some type of structure in your body. So for example, in our bicep, if I am flexing my bicep, so I'm decreasing that angle, my bicep is contracting, okay? So it's pulling the hand closer to the shoulder. The tricep is relaxing. What does this result in? This results in our muscles being able to do stuff. Our muscles start to contract and move. When our muscles move, they produce thermal energy. Thermal energy is heat energy. So when you start moving your body rapidly and those muscles start contracting, you find yourself getting warm and starting to sweat. That increases the body temperature, right? So that heat keeps our body temperature constant. So if you've ever experienced being cold and you get goosebumps, what your body is doing when you get goosebumps is it's contracting those little hair fibers to stand up. Call them goosebumps. That bump are actually just your little muscle fibers contracting. That very act of contracting those muscle fibers causes the body to warm up. And where do we get that energy for these muscles to contract and generate heat? We get that in the form of glucose. And remember, glucose is any type of carbohydrate that we eat. When we use up all of our glucose and we don't have fuel for those muscles to fire and move, those muscles are going to tell you that they are tired and that they need to rest. Over time, if you continue to work muscles, they can become bigger if you're weight training them, or they can become smaller. They become larger by weight training or doing muscle-bearing activities, and they can become smaller if you have an injury or you're maybe stuck in bed and not moving around as much, and we call that atrophy. So let's break down the muscle groups that you will have to know for this class and for your exam. The first one is your deltoids. So your deltoids is basically the big muscle that's right around your shoulder blade. You have a front delt and you also have a rear delt. And the function of that, you can go ahead and put your hand right on your shoulder. It helps lift your whole entire arm up. So you can get that big range of motion. Sometimes if you lift that arm all the way up over your head, you might be able to feel both your front delt and your rear delt depending on how much muscular development you have. Our next one are your trapezius. So it's this big V-shaped muscle. It runs right along the base of your neck, down your spine. It runs right across your shoulder blades, and that helps raise your shoulders up and down. So if you were to shrug your shoulders up towards your knees, your ears, and then pull them right back down, you are using your traps in that muscle. Sometimes kids have a hard time remembering the name of this. What I always think of is right here, it's a big V. So think of it as it's like it traps. If something were to fall down in here, it would trap it down in there. So that V-shaped muscle. So deltoids lifts the arm. Traps are going to raise the shoulders. Biceps and triceps, these should be ones that you're very familiar with. So biceps, bi means two, which means there's actually two heads to that muscle. You've got the long head and you've got the short head. And so it's going to bend my elbow towards your face, or it will lift your arm straight up. So think about if you're doing a shoulder press, right? You're going to be using not only your deltoids, but you're going to be using your biceps to lift when you're doing a shoulder press as well. Triceps, the word tri means three. So there's going to be three muscle groups in your triceps. So they're found on the back part of your arm, and they're going to allow you to straighten your arm back out or straighten your elbow behind you. So the bicep will contract while the tricep relaxes. And then when you do a tricep extension, that tricep will contract and that bicep will relax. Your pectoralis and your latissimus dorsi. Oftentimes people call the pectoralis just the pec muscle. So that is the muscle that goes right over your breastbone. Oftentimes we refer to males as having pecs. But ladies, we do have pecs as well. We just have breast tissue over the top of them. So what do our pecs do? They're going to move the shoulder and the arms towards the chest. So think about doing a push-up or a chest press or pushing those arms away, that was how you would be activating your pec muscles. On the posterior side is our latissimus dorsi. A lot of times people refer to them as your lats. And you can see your lats go right down your spine and your rib cage area. So think about if you were to give yourself a bear hug and reach behind you, that whole back portion is going to be your lats. So they attach near your tricep area and will pull all the way down through your armpits, through the back of your body. And those are going to allow you to pull your arm towards your back. So think about if you were doing a fly, a chest fly, and you're opening up those arms maybe to give that big, huge bear hug, you're going to feel that contraction of the lats. If you were to go to a pull-up bar or a pull-up machine and pull yourself up, you're going to be using your lats in that frame. Your gluteus maximus and your abdominals, so your glutes is your butt cheeks. There's gluteus maximus and gluteus minimus. There's also gluteus medius. So there are big muscle groups in there. And if you've ever had a glute injury, there's a lot going on in that area. So it's one of our biggest muscle groups that we have besides our quadriceps in our body. And what the glutes are going to allow you to do is straighten the leg at the hip. So for you to extend that leg straight out when you're standing up. So if you're coming from a seated position like a squat and standing straight up, that straightening of your leg will then fire your gluteus. Your abdominals on the front side have many different parts to them, but that's your stomach area. We oftentimes talk about the six-pack abs, but that's the one that's towards the front there. So you can see that there's many different parts to your abdominal muscles. You've got the rectus abdominis. This is the one we refer to when we talk about your six-pack abs. You also have the external and internal obliques. So these are going to be your side body right here. And then your transverse abdominis is going to be more towards the inside. Hamstrings and quadriceps. Hamstrings are the back of your body. What those are going to do is they're going to bend the knee and straighten the leg. So if you were to be doing like a seated leg extension, okay, and pulling that leg back, that's going to flex and extend your hamstrings. And you can see many more muscles besides just saying hamstrings. You have the biceps femoris, the semitendinosus, and the semimembranosus. So lots of different muscle groups back there. Quadricep, one of the biggest muscle groups in our body. Quad means four. So there are four muscle groups to the quadricep, but you only have to know the name of it. That is going to allow you to straighten the knee and raise the leg at the hip. So if you were to do a high knees, or if you were to run, anytime you drive that knee up, your quadriceps are going to be firing. Gastrocnemius and anterior tibialis. These are our last two of our slides. The gastroc, sometimes we call it. Otherwise, we would say our calf muscle. So that is the back or the back of your leg, the calf muscle. It's going to allow you to stand right up on your tippy toes as it contracts. And you can see that there's a lateral head and a medial head. And sometimes you'll get some really good definition. If some people are really strong, you'll actually see that kind of little V-shaped structure in there if you have a really well-developed gastrocnemius. That is going to then connect into the tendon of the soleus and then into your Achilles tendon down here. You might hear that people sometimes will have injuries where they'll rupture their Achilles tendon or their Achilles tendon will snap, which obviously makes it difficult to walk because you don't have your quadricep muscle, your calf muscle in order to push off in that walking motion when you push off on your toes. And then the front side of your body, the anterior tibialis, runs right along down the tibia, which we learned about in our bones lecture. So it's going to be the front part of it, and it's going to pull the foot towards your lower leg. So think about if you're flexing your toes, or pointing your toes, you're going to be activating your anterior tibialis. And oftentimes, if you are going out running for the first time in a long time, it's the part that gets sore really, really quickly. It's not your shin splints, it's the outer portion of it, but it tends to get really sore when you start running for the first time. So that is it. That is all the muscles you guys have to know. Good luck on studying them, and thank you for watching.